My name's Steve, I'm patient coordinator here at the Birmingham clinic. Today I'm having FUE with Dr Michael Mouzakis. I'm having it done to my temples and my crown. I've wanted to have this procedure done for years now. I started losing my hair when I was about 18, 19, so it's been a gradual process. I'm 33 this year. I've worked in the industry for about 7 years, and it's the first time I've felt really comfortable with a company and especially with the surgeon. And Michael's background is plastic surgery and NHS, so he knows the anatomy really well. So I felt really comfortable with him, and obviously I work with him every day. I sit in his consultations, I consult on his behalf, so I know so much more about hair through him, so it's installed confidence in me. And the company as well, aftercare is really important here at the private clinic, so we look after our patients really, really well from start to finish, so that's made me feel really confident and made me want to have the procedure done, definitely with the private clinic. I've just come off holiday, so I've had to wear a cap the whole time I've been on holiday, and also SPF on my scalp so I haven't burnt it. That's Michael's strict orders. I haven't been able to have any spicy food or any alcohol or any coffee for a week before the procedure, and also I can't have any coffee or anything on the morning if I'm having the procedure done. I've also had to wear a loose fitting top so I can put it over onto my head after the procedure rather than something tight, because obviously it would damage the follicles. And I've had to buy some baby shampoo as well, so you have to wash your hair with baby shampoo 4th day post-op for a week, so I've had to get that. It's a really straightforward process. I haven't had to do much preparation. It sounds a lot, but it hasn't been that difficult, to be honest. It's nothing out of the norm. So it's been a really easy, straightforward process. I don't feel stressed out about it. I don't feel nervous or anxious or under pressure. The only thing I feel a little bit anxious about is the injections, because I've got a little bit of a needle phobia, but I'm sure I should be okay on the day. I feel good today. I feel really calm. I feel really collected about everything. Usually I'm quite an anxious person, but I feel really calm about it because obviously I know I'm in really good hands with Michael. I know who I'm working with, I know the technicians really well, and I obviously know the clinic really well. I work here every day, so I just feel really cool about everything, so I'm ready, I'm really excited.
I'm Michael Mouzakis. I'm a cosmetic doctor and hair transplant surgeon here in Birmingham at the private clinic and also in Leeds. I'm really glad today because I will be offering a procedure, FUE partially shaven to Stephen, who is my patient coordinator for hair restoration in Birmingham. It's his big day because he wanted that quite a long time. So he's the perfect candidate. He's fit, he's well, he's at the perfect age, in early 30s, and he has a typical problem, a pale area over the crown. And it's the partially shaven FUE. It's the ideal procedure for young professionals like him. I will only shave the donor area to expose and find the best grafts, and then I'll only trim the recipient area, which will be the crown, and quickly implant the follicles, and that's it, without changing his look. It's called also the marine haircut and has minimum downtime, and I want him to share his experience throughout the procedure with future patients.
How are you feeling today, Stephen?
I feel good, I'm excited, I'm ready for it. I've wanted this for a long time, so I'm happy. So people would always comment on my hair loss, you know, from behind. If they were walking downstairs, they'd always say something about my crown, and it obviously affects my confidence, and especially the job that I work within. I'm customer facing a lot, you know, I'm obviously doing consultations, and I do care about my appearance, so I want this done for me. So I feel like now it's the right time, I'm at the right age, I'm working with the right company, with the right surgeon, so I feel like I'm ready for it at this stage in my life. So I'm feeling okay at the moment. I've had my injections, which were a little bit painful to begin with, just a scratch, but after that everything's been fine. I'm having my extraction at the moment, so the follicles are being removed on the back of the head, which is quite a long process. But everything's okay, I don't feel any pain. It just feels a bit uncomfortable, like lying down for a long period of time, but other than that everything's fine. So we're halfway through now, we've just broken for lunch and I'm feeling fine. I've actually really relaxed, I fell asleep a few times, so it wasn't as bad as I expected. The only thing that was a bit of a pain was the injections, but they were just small, sharp scratches. So it was the extraction this morning, just taking the follicles out the back of the head, and now we're doing the implantation. So it'll be the follicles being placed into my crown and then my temples. That'll be the rest of the afternoon, so that'll be the rest of the day. Oh gosh. That's amazing.
You can see
You didn't hear it as well?
Yeah.
Yeah.
A little bit more to the bottom. There's no space.
Gosh.
Okay?
That's amazing.
Good.
Okay, so we've just finished the procedure. It's 5 o'clock and we started at 11, so it's been quite a long day. The first part of the morning was the extraction from the follicles from the back of my head. Then we broke for lunch, and then we've just finished the implantation to my crown and to my temples. There was no pain at all. The only pain was the injections. It was a really easy process. It was comfortable, I felt at ease. We had the radio playing, so it's a very relaxed environment. I didn't feel anxious or anything like that. I was checked on constantly to see if I was okay. So I would totally recommend it to anybody. I'm usually quite scared with stuff like this, like the dentist and the doctors and any small operations I've been quite scared of. But I've been really fine and really calm and collected. Now it's just the aftercare stages, so I'll need to take my antibiotics. I need to also spray my hair every half an hour whilst I'm awake for the next 4 days to keep my scalp moist. So the next 4 days are probably going to be a bit of a challenge, but I'm just excited for the final results.